HIV infection is treated with ART drugs, which are specific medications that help maintain the immune system at a high level and enable it to resist the HIV virus. But I want to emphasize that these drugs do not cure HIV. They do not destroy the virus. They only suppress the replication of HIV. So Arkansas T therapy, which is vital for these patients, truly allows them to live, work, start a family, and continue their lives with HIV infection. ART therapy consists of what are called 3 medications. It is mandatory to take 3 medications when undergoing ART therapy. Currently, Arkansas T therapy is provided free of charge to all patients in our country. When I started working, which was about 20 years ago, there was very little ART therapy available, and it was given to patients whose CD cells, these are the cells responsible for the immune system in our body, were below 200. Let me tell you, normally CD4 cells, again, these are the cells responsible for our body's immune system range from 450 to 1,500 in a healthy person. Previously, Arkansas T therapy was given to these patients only when their cell count was low, because unfortunately there simply wasn't enough of it available. And when the cell count dropped below 200, specific ART therapy was administered. Later, these criteria were revised. ART therapy started being given at 350 cells. Then at 500 cells, there was a review. Now, Arkansas T therapy is provided regardless of the cell count in an HIV positive patient. ART therapy is now administered, I repeat, at different stages of the disease, whether it's the first, second, third, or fourth clinical stage. ART therapy today is highly specific. In what way? When we first started working, it was quite toxic, quite hard on the patient, and there was a huge number of medications. It could get to the point where a patient had to take up to 10 pills a day. This was very difficult for the patient, and special preparation was needed, meaning we had to develop the patient's adherence to this therapy so that they wouldn't skip it. I'll mention later on that the therapy must be taken at specific times. This is very important. So the word adherence, meaning adherence to taking these pills, is extremely important. Of course, science does not stand still. Over time, research has significantly progressed, and now some patients, or rather indeed many patients, only need to take a single pill each and every day. In other words, scientists and pharmaceutical company developments have made it possible to combine 3 essential medications into a single pill for these people, and they only need to take 1 pill a day. Now, these medications have become much easier to take, much more accessible, and they cause fewer side effects, which is why taking them is absolutely vital. When patients come to see me, I explain to them that life doesn't end, that there are medications available, the government provides these medications for free, and you will be taking them. It's not like with diabetes where you have to inject insulin every 3 hours. It's just taking 1 pill a day, and you can continue to live a full life without worry. Also, I'd like to point out that we'll return to the laboratory clinic, to the laboratory manifestations of HIV infection, which are related to the CD4 cell and viral load. Let me repeat. CD4 cells are specific cells in our body that are responsible for the immune system. The higher the number of CD4 cells in the body, the stronger the immune system, and it suppresses any manifestation of viruses. So what does the HIV virus do? It suppresses CD4 cells, destroys them, and the person becomes defenseless against any infection. That's why the therapy is aimed at increasing these cells so that people have a strong immune system. And there is such a concept as viral load. Viral load is the amount of virus in 1 milliliter of blood. Patients can have different viral loads. I've seen patients with a viral load of up to 2 million. That's enormous to 1 million viruses in just 1 milliliter of blood. Can you imagine that? That's why viral load is one of the main indicators that ART therapy targets. ART therapy is aimed at reducing the amount of virus in the blood. In practice, we bring it down to almost zero. And what does this ultimately achieve? The most important result is that a person with an undetectable viral load cannot transmit the virus to a healthy person during unprotected sex. And this has been proven. This is the basis and the purpose of ART therapy. We are, in a sense, working in two directions. We give a person the opportunity to live by boosting their immune system. And secondly, we break the chain of HIV transmission because a person taking ART therapy does not infect another healthy person.